Now, in more news, health workers from different districts of the country have been trained in the management of mental health victims. This has been disclosed by the Assistant Commissioner Mental Health Control Substance Abuse, Health Uganda, at the launch of the mental health hotline in Kampala by Mental Health Uganda.
Welcome to the Mental Health Uganda toll-free helpline, where you can receive counseling and guidance on the different mental health conditions. Please note that this call will be recorded for research and follow-up purposes.
Despite having a challenge of inadequate funding of mental health programs, Mental Health Uganda has launched a toll-free helpline to aid in counseling of mentally ill patients. The service is to operate in 8 districts of Gulu, Kampala and Mbarara, Soroti, among others.
What the helpline is coming to do is to provide a safe space for young people to have someone to talk to. So when they have a mental health problem, they can call. What we have done is that, what we are going to do going forward is that we can provide counseling, but we also have established a very strong referral system in regions of Uganda. So when they are not able, even with counseling, you need a support network around you, because they are the ones that are in your area. They are the ones that you can see regularly, because sometimes they are a walk away from your home, and so then these can support you into proper recovery.
Derek Chiza says there is need to engage communities about mental health, with much emphasis on family members of the victims to reduce on the negativity about mentally ill patients. He says many victims were affected by the COVID-19 period, with many patients failing to get medical attention, hence the need of psychosocial support.
Many young people fall victim of peer pressure, but also many do not have the experience or are not in the best of environments to deal with the pressures that come along in life. So then, because of this, suicide becomes an option. So that's why you see that you have cases, increasing cases. They might be spontaneous, but on the increase. For instance, at universities, we have read many media reports where at universities people are taking away their lives.
Development of a mental health investment case has been advocated for by coming up with innovations to improve on the mental well-being. The Assistant Commissioner, Mental Health Control Substance Abuse, Health Uganda, says development of a health insurance scheme will also reduce on health spending.
About community mental health, yes, we are now shifting from the clinical side, from the clinical services to community services. Just like all the other presenters have said, it is not possible to manage or to improve mental health without including the community aspect. We cannot heal mental health or mental health problems within health facilities. First of all, the illness itself takes on the chronic mode. It is not something like you take one Panadol and you're better. It takes on, a long time. You need to take on your medicine. For some people, it's for life. So with such an illness, we cannot expect it to be treated within the health facility only. It has to have a community aspect of things. And within the communities, it has to be the family. And what is missing out in families? Families are not appreciating that any of their members can be sick. And once it is clearly in black and white that someone is sick, then they want to dissociate from that person. They don't want to be part of that person. They don't want that person to be part of their family.
Lukwata says the sector is grappling with the changing statistics in regard to mental health because of the increasing number of patients. Raising awareness about mental health has been identified as being important, with a slogan, "Conversation changes lives." Sudat Kaye, UBC.